In your health headlines tonight, summer is here and that means more time in the sun. But according to a new report, many Americans are spending too much unprotected time in the sun. Dr. William Groff is here tonight to talk more about melanoma skin cancer rates that have doubled in the last 3 decades. Thanks for being here, Dr. Groff.
Thank you. Good to see you, Kathleen.
So my question is, we do this every year, really. Why are we seeing these numbers of cases skyrocket, and are we just not getting the message?
You know, I think that's a great question because I think we are getting the message, and I think a lot of our patients and the citizens of our community are using sunblock more, and they're more aware of the sun and its dangers. What I think we're really seeing is, you know, skin cancers come from cumulative exposure to the sun and to sun tanning lamps. And if you think back to the 70s and 80s, people were tanning like crazy. I mean, think how dark people were getting back then. And also think about the fact that tanning beds started to be used quite predominantly in the 70s and 80s and through the 90s. And we're seeing the cumulative result of all that ultraviolet radiation exposure coupled with an aging population. And that's why we're seeing these rates double, in my opinion.
Well, what makes melanoma itself so incredibly dangerous and possibly deadly?
Well, the thing about malignant melanoma is that if you catch it early, it's 100% curable. So if you catch it at an early stage when it's just on the skin, it's great because we can cure the patient. But if it's spread to the lymph nodes, into the bloodstream, into other organs, it's almost universally fatal, with rare exceptions. So we really want to catch these things early. And for example, the way we're trying to reach out to patients is at our practice right now, we're offering free skin cancer exams. And as a matter of fact, today alone, we picked up 1 melanoma in a patient who otherwise would have probably slipped through the cracks and very well could have progressed to a further stage and poor prognosis. So that's one way that we can help reach out to the community and help patients who might not have insurance or what it may not be able to get in and see the regular dermatologist so they can come and see us.
Well, let's talk about some of the risk factors. What are some of the risky behavior that people still partake in?
Well, believe it or not, people are still frequenting tanning beds, and that's really, really awful for your skin, and it certainly significantly increases your risk of skin cancer. We still want to emphasize the use of sunblock, trying to avoid direct sun exposure between 10 and 2, and if you're going to be out there, you have to remember to reapply your sunblock every 2 hours or so, particularly after swimming.
And what are some of the signs and symptoms to look out for? How can you detect it?
Well, the number one thing is to look at the moles that you currently have and if they're changing. So if they're becoming larger, if they're changing size, shape, color, if a mole that you have is starting to bleed or itch, that can be a warning sign. We call these the ABCDs and E's of melanoma. A standing for asymmetry. In other words, if one half of a mole doesn't match the other. B is for border, meaning if the border of the mole is irregular or odd shaped. C is for color, and that means if there's more than 1 or 2 colors in the mole, that can be concerning. D is for diameter, meaning if a mole is bigger than the size of a pencil eraser, you should have your dermatologist take a peek. The last one, E, means evolving or changing. Is the mole getting bigger? Is it changing size, shape, or color? That is a warning sign that needs to be addressed.
All right. Well, Dr. Groff, thank you so much for bringing this to our attention once again.
Welcome.
Hopefully people will heed your advice.
Yes, I hope so.